Hello, everyone. I'm here today with Dr. Rizkallah. He is an orthodontist in Massachusetts. He's also a real estate mogul. He has written the law we all know about. It's called Massachusetts Question 2. He's the president of the American Alliance of Dental Insurance Quality. Today, we want to talk about this Medicaid compliance. Why a dentist like myself, who doesn't participate in Medicaid, should be paying attention to these laws, and tell us about this resolution that you want the ADA to adopt.
This is a resolution that the House of Delegates of the American Dental Association, in my strong opinion, should adopt fast. Let me read it to you. It has multiple parts. Resolved, the Health Policy Institute, HPI, shall investigate each state's Medicaid program for compliance with 42 U.S.C. 1396A30A of the Medicaid Act, and be it further resolved, the HPI shall produce a report outlining non-compliance with 42 U.S.C. 1396A30A for each state Medicaid program. So they're going to investigate it and they're going to create a report on every state in terms of their compliance. And be it further resolved, the Board of Trustees of the American Dental Association, in concert with the Council on Dental Benefits and the Council on Government Affairs, will edit and finalize the non-compliance report, which is produced by the HPI, for submission to the Center of Medicare and Medicaid Services, known as CMS. The report submitted to CMS shall also reference the relevant case law that requires full compliance by every state with the Medicaid Act, and be it further resolved that the BOT, the Board of Trustees, will support states with litigation funds for federal level court actions should litigation be required to enforce compliance in states that refuse to be compliant. So what I'm saying here is the ADA should adopt a policy that takes the HPI, which is instructions on what to use this very well-funded component of the ADA, give that directive and say, go in every state, investigate their compliance with that specific law, which we'll go through, come back with a report, and then we'll edit it, and then we'll submit it to CMS, Center for Medicaid Services, and tell them what they're doing wrong. We are going to investigate it and tell about it and complain about it at the state level. And if that doesn't do it to get those states to comply, we're prepared to sue them in federal court. That's the point.
Mo, you talk about these laws. What are they?
Yes, so that's the right question. So 42 USC 1396A30A is actually the most powerful law in Medicaid. It's the most powerful line in Medicaid. Okay, and most people don't know about it. It requires Medicare coverage for children. Adults are optional. So any laws that you see in Medicaid are children's Medicaid. Let me read it to you, and then we'll explain it. 42 USC 1396A30A is what you have on the screen here. And it's hard to understand it initially, but let me read it once, and then I'll parse it out. It says, states must assure that payments are sufficient to enlist enough providers so that, in bold, care and services are available under the plan, at least to the extent that such care and services are available to the general population in the geographic area. This is powerful. What's it talking about? It's talking about payments. It's telling states must assure that payments are sufficient. How sufficient? Sufficient to enlist enough providers. So you see, the analysis is not how much do you want, it's they need to have enough providers, so sufficient to enlist enough providers. So that what? So that care and services are available under the plan. To what extent? At least to the extent that such care and services are available to the general population in the geographic area. I'm going to break it down again because it's not enough to just read it 3 times. You have to read it 4, 5 times to really get the gravity of what this law is saying. It's basically saying, if you're not on Medicaid, you should have less access than someone who's on Medicaid. That's what it's saying. Where is it saying that? It's the word at least right here. This is where it's saying it. Care and services are available under the plan at least to the extent that it's available to a non-Medicaid patient in a geographic area. Now, why is geographic area important? And I call this most version of what this is, I call it the geographic area law. It's an easy way to describe it. Why in the geographic area? For example, in Massachusetts. Massachusetts is broken up into a more metropolitan area, then a more central state area, and then a western Massachusetts area, which we call loosely the Berkshires. Out there in the West, there's just nobody there. And there are people out there who don't have dentists. Those dentists need to be paid more. Why? Because that's what this law is saying. It's saying in the geographic area, if there is a deficiency in that geographic area, you need to make sure that there are more Medicaid providers available there. To what extent? To the extent that at least to what's extent in that area for general population. So nobody out there is even taking Medicaid. So we've got to make sure that the Berkshires or any portion of any state has compartmentalized their problem, their access problem. That's the geographic component of this. But setting aside the geographic component, what we just read together makes the Medicaid Act for patients under 21 years old the most powerful insurance on the planet. And that's why I'm saying the Health Policy Institute should be doing what is really a simple policy analysis. And if they did this, they would change the country. We would change the country. You submit that report. The way I've written it, the resolution is that the HPI would produce it. They would submit it to the Board of Trustees, and the Board of Trustees of the ADA, in association with two councils, which I mentioned there, would edit it, polish it, prep it, send it to the Center of Medicaid Services and say, this is non-compliance. The report submitted to CMS shall also reference the relevant case law that requires full compliance by every state with the Medicaid Act. This document is a 2005 decision from the United States District Court, District of Massachusetts. This is federal court in Massachusetts. And the question here related to 42 U.S.C. 1396A, which is the larger law in which 30A is included. So I've been citing 42 U.S.C. 1396A, 30A. This decision is talking about that package of laws. The defendants are the Commonwealth of Massachusetts. The state of Massachusetts was saying, we have substantial compliance. Not full, but we just have to do substantial compliance. I'm going to skip down and just go right to the heart of the decision. Accordingly, the standard to be applied in this case will be full compliance. How? That's huge. And that's why I'm saying we need to file, if litigation is required, we need to file it in federal court. Why? Because this is a federal decision. It will influence future decisions. And you don't even need to file it in court because CMS knows. They know, and states know. What you need to do is to have a powerful organization like the American Dental Association compile this information, platter, and say, we know about this law. We know, and we're going to enforce it if we have to, but we want you to know we know that full compliance is required. None of these states are complying. We need to figure out if the states are providing payments sufficient to enlist enough providers so that care and services are available under the plan. That's first part. The second part of this statement it starts with the word at least to the extent that such care and services are available to the general population. So the second part is basically saying you need to also do that for non-Medicaid providers. So now back to your last question, if you could sort of repose that to me.
What I want to know is that why should I even pay attention to this, Mel? Well, I know many dentists say, oh, I don't want to get involved with Medicaid.
Right. So this is a really interesting misunderstanding. People say, I don't care about Medicaid because I'm not in Medicaid. Yes, you are. You just don't know you're in it. Medicaid is a set of laws, and it is governed by the Center of Medicare and Medicaid Services. Okay. Now, Medicaid pervades all of healthcare. Okay. It sort of sets the bar for what does the government believe is the standard for healthcare. So, for example, the medical loss ratio laws essentially are governed at the federal level by the Center of Medicaid Services. I'll go a step further. Insurance standards in terms of the loopholes that insurers can use in terms of charitable contributions, are they allowed to pass through broker fees to patients, or do they have to pay them out of their administrative fees? All these questions. That's governed by Center of Medicaid Services. The term medical necessity. Sadly, people think dental care is not in the word medical necessity, but it is. The medical necessity standard of what must be covered is the most beautiful language that you'll find in Medicaid laws, state and federal Medicaid laws, that talks about really what it needs to be covered under medical necessity. That applies to dental, okay? Those standards are established where? In the Medicaid Act, okay? So when you're saying, they won't cover that for my patient, they won't cover it because the Medicaid Act doesn't require it. They're allowed to hide behind the government standard. But it's worse because they not only hide behind the government standard, they create it. The insurers create that standard and influence the standard. And what do those standards do? Those standards make it so that it's harder to get approved for something. Okay. And then the states are like, oh, you mean you can save us money by making a limitation on crowns that's 5 years? Yeah, we could do that. Is it okay to do that? Oh, yeah, it's okay to do that. Then the state adopts it. Then what do you think the private insurance does? They adopt it. Okay. And the Division of Insurance, who would say, hey, why are you doing that, would be corrected by saying, oh, well, we're just following what the state did. Never mind the fact that they're the ones who did that. Okay. This is the cycle of regulatory capture. And that's why it's important that we have a robust Medicaid program, because then the private insurers cannot hide behind the argument that, well, the government says that that's okay for medical necessity, and everybody knows the Medicaid program is a robust program. Medicaid policy controls private insurance. So you really need to be thoughtful about making sure Medicaid is supported, and because it does end up dominating, not even just affecting, it ends up dominating how your insurance plans are covered, what the rates are. It affects UCR. It affects all of it. So that's not a thorough answer, okay? But I think it captures enough to make my point.